This conference will now be recorded.
Okay, so thank you to everyone for joining us on our virtual town hall today. We are very happy to have Carol Mead from the Make It Okay planning group and Christy Aquino from Unity Point Health in Cedar Rapids here to talk about Make It Okay. This is a virtual town hall that's part of our series on COVID-19. And as many people know, COVID-19 has had quite an impact on mental health for our community. Mental health is a priority area for our community health improvement plan in Linn County. So we're happy to provide this opportunity to share some information about Make It Okay as it relates to COVID and as it relates to our community health improvement plan. So the way today's virtual town hall is laid out is that Carol and Christy will provide a brief presentation and remarks, and then we can take questions from participants that are attending virtually. If you do have a question to submit, you can send that question through the chat function within GoToMeeting, or you can email it to lcph.meetings@linncounty.org, and I will receive that email and pass that question along to our speakers. And just as a reminder, this meeting is being recorded and will be posted publicly. So we are going to get right into our presentation for today. So I am going to let Carol introduce herself and provide her remarks. Go ahead, Carol.
Excellent. Thank you, Caitlin. Thanks for having us here today. So I'm going to go through a brief overview of some of the Make It Okay information that we have. And then I'm going to pass it over to Christy Aquino, who's our EAP coordinator with us here at Unity Point St. Luke's. And she'll talk a little bit about more specifically what you might be seeing and how people might be impacted by COVID and their mental health and some of the strategies that, or some of the stressors that they might be experiencing. So I want to start by just going over why Make It Okay is important right now. There's a lot of data available to reinforce the importance of talking about mental health as much as we talk about our physical health. On this slide that has information gathered from the Community Health Needs Assessment, which is completed by our local public health agencies every 5 years. You can see that in 2016, mental health was identified as a top health issue in 86 of the 99 counties in our state. So this really highlights the importance of focusing on our mental health as much as our physical health. So Make It Okay is a community campaign to reduce stigma by increasing awareness and creating conversations about mental illness. Make It Okay is really simple, but it has a very important message, and that is that it's okay to talk about mental illness. It's okay to have a mental illness. It's okay to get support for a mental illness, and it's okay to have a loved one who has a mental illness. Really simply, what is Make It Okay? There we go. Sorry, I'm having a, there we go. And how do we start changing attitudes and reducing stigma? We're going to start talking about that today, but we really take a learn, talk, share approach. So we want to start learning about Make It Okay, mental illness and stigma, and its impact on our neighbors, our colleagues, and other people in the community. We also want to learn basic diagnosis and symptoms. We want to learn how to talk openly and compassionately about these issues, what to say and maybe what not to say. So we'll talk a little bit about that. And finally, we hope that you leave here feeling a little bit more equipped to share with others this message. So we'll start by talking about stigma. By definition, stigma is a set of negative beliefs that a society has about something. Stigma of mental illness includes the negative ways we think about what someone looks like or the words we use when we talk about someone who has a mental illness. Stigma of any kind is a negative mindset and provides no value to society in general. And really it boils down to discrimination, leaving people who have a mental illness or those who care for them to feel like they're not as valued and are perceived as a burden or even dangerous. And we know there's a stigma around mental illness, and that's why we're here today. So I want you to take a minute in your mind and just think about what images do you see in movies, TV, news, ads that portray people with mental illness. Common stereotypes that come up around mental illness are that they're violent, dangerous, institutionalized, or out of control. However, this couldn't be farther from the truth, because really only about 3% of individuals with a serious persistent mental illness are actually violent. Yet these images can leave lasting impact in our minds, and they can change the way we think about people with a mental illness. The reality is 1 in 5 adults will experience a mental illness in their lifetime. And if you put that in perspective, about 1 in 8 people have diabetes. And yet how much do we talk about diabetes and what we need to do to prevent physical conditions like that? And that's because of stigma. We know that most of us have been touched by someone with mental illness, and we may have experienced mental illness ourselves. And that's why it's so important to start talking and learning more about mental illness. So just to highlight that a little bit more, think in your mind of what are some common terms that you use to describe people who are experiencing cancer. Many things that come up are warrior, fighter, brave, strong. And rightfully so. People experiencing cancer deserve to have those reassuring terms. But what are some of the terms that we use when describing people with mental illness? Some of the things that I hear are crazy, wacko, nuts. Why wouldn't we use the same terminology for people who are experiencing mental illness as we do for people who are experiencing cancer? It takes just as much of a warrior to fight mental illness every day as it does cancer. So we're taught as children about illness like colds, broken bones, or surgeries, but mental illness isn't discussed very much. Mental illness should be discussed just as much as diabetes. It needs to be seen as a normal illness. And I can speak from my own personal experience. My husband is type 1 diabetic, and so we talked a lot about that as my kids were little, and why Dad had to take shots so many times a day, and why he was checking his blood sugar so frequently. And even me, who's spent almost 30 years in this field, could probably have done a better job of talking to my kids about mental illness and some of the things that maybe they were seeing in family members or classmates. So I know that we can all do a better job with that. The reason this matters so much is that stigma is the greatest barrier to individuals who are seeking help regarding their mental illness. Stigma causes shame, it causes isolation, it can impact your job and education. The impact of waiting to seek treatment can include the loss of employment and income. And we know that right now during this time of COVID and isolation, that people aren't seeking treatment as they should. And we know that there's barriers that have increased as a result of that. It's okay. Oops, I think I might have advanced it too fast. That's okay. There you go. It's okay to seek help though, because it is a medical condition. It's not a character flaw. It's not a disruption in your it is a disruption in your thinking, feelings, moods, and the ability to relate to others and your daily function. You can't overcome it with willpower. We can't pull ourselves up by the bootstraps. It's really important that we realize that mental illness is biological in nature, related to environment, genetics, chemical imbalances, and sometimes trauma. I'm not going to spend a lot of time on the symptoms and diagnoses, but I think it's important for all of us to be aware of them and to learn what some of those common symptoms are so that we can identify them in ourselves as well as in our family members and friends. Not because we should all become clinicians, and I expect that people would be able to diagnose people, but just so that we have more of an awareness of what people might be experiencing. I'm sure that most of you have seen most of these common diagnoses, and there's many more as well. But it is important that we know what they are, and it's also important that we get comfortable talking about them and using the proper terminology. Most of us aren't afraid to use the word diabetes or use the word heart disease, and so we shouldn't be afraid to use some of the words like bipolar disorder or schizophrenia or substance use disorder. Any one of those things, we need to feel more comfortable using the actual diagnosis terminology. And how we use it is really important too. I've heard people say things like, he is bipolar. We don't say someone is cancer, so we should be careful how we label people as well. You know, it's really important to remember that mental illness is treatable and recovery is possible. A combination of treatment and support can be part of anyone's individualized plan. So I just want really one of the most important pieces with this presentation today is to be talking about how important it is to make talking about it okay, and that it's okay to not be okay all of the time. And then how do we help our friends and colleagues seek the treatment that they need? And I'm going to take just a couple minutes to kind of move into that next phase, is how do we support someone who is experiencing some symptoms of mental illness? How do we start to make it okay? So the first thing we need to really do is stop the silence around it. You know, I can speak from my own personal experience. It's easier for me to talk about it in my work environment than it is in my home environment. It's easier for me to bring up some of these topics with colleagues than it is sometimes in my personal life. And that's okay. It's one of the things I tell people all the time, just like having some of those really challenging conversations with your kids, like talking about sex. The more you talk about it, the easier it is to have those conversations. And so we need to just become more comfortable with it. And the really basic, it can be very basic and not complicated. And to begin with, just be nice, listen, don't ignore, don't change the subject, but ask questions and offer support whenever you can. Just like you would if they had a physical condition. So as we think about what to say and what not to say, see if I can advance the slides. Here's some things that we shouldn't say. Sometimes one of the things we do here in the medical field is we give people scripting. We actually tell people what to say because sometimes we don't stumble around our words quite as much. So it's really important to be thinking about what are some things that are okay to say and to really focus on some of the things that are not okay to say. So you need to just pull yourself together. Why don't you try just thinking happy thoughts? Those are some things you probably shouldn't say. But again, really simple things, the same things that you probably would say if somebody had a physical condition is, how can I help? Is there anything I can do? I'm sorry to hear that. That must be really hard. Using words of empathy are really, really important. So right before I pass this off to Christy, I just want to highlight some Make It Okay key messages. And I also want to let everybody know that we will be having more, you'll be hearing more about Make It Okay in the community. This fall, we hope to have a series of speakers. So what I really like about Make It Okay is that it's common language and we can all use the same words to feel more comfortable talking about mental illness and help reduce the stigma. Mental illness is really common. It is a medical condition, and stigma is what keeps people from seeking support and seeking treatment. And we know that right now, because of COVID and isolation, that people are struggling even more. And I'm going to pass it off to Christy now and have her kind of highlight a little bit of what you might be seeing and what people might be experiencing right now. Thanks. I think you're muted, Caitlin.
Thank you, Carol. I appreciate that.
I
I was just introducing Christy and welcoming you to share your experiences and information that you have for us today.
Thank you, Caitlin. Thank you, Carol. Yeah, so Carol touched on a lot of great things, and the Make It Okay campaign that we started before COVID ever came about is so powerful, because the stigma around mental health has been going on for years, and it just isn't changing and isn't going away. And truthfully, through COVID, what we've seen is more people are experiencing the stress and the anxiety and the depression symptoms. And if they experienced them before, they maybe are becoming more magnified for them and more intense. People who haven't experienced them in the past are now experiencing them. Life has changed so much in such a short amount of time that we're all having to adjust. We don't really know what life is going to look like. We are trying to take it day by day, and that's changing all the time as well. So if we talk about isolation and this for social distancing purposes, and maybe somebody who already experienced some social anxiety, and now we're asking them to isolate, and how are they going to get acclimated back into society with their social anxiety that they have been experiencing. So those are challenges that we're seeing that I'm having to talk people through on a regular basis, and work through and do some exposure therapy stuff with them. Returning to work as well. We have a lot of people who, you know, are working from home, the fears of returning to work and what does that look like for them in their workspace, or returning to their place of worship, and how can they do that and be safe, because we all know that spiritual health is so important, especially now. And so how are they getting back into that space that is a huge support for them, and while still being safe and making sure that the people around them are safe. So the social distancing in itself has created some anxiety, a lot of stress for people, because they not only want to make sure that themselves are safe, but the people around them. So, and then we talk about school. You know, the kids have been out of school for so long, and the amount of time that parents are spending with kids, whether it was teaching them and now trying to entertain them for the summer, and what does it look like for them to return to school in the fall? We don't even know. So all these stresses, I've even heard parents say, well, I have to quit my job because I'm going to have to teach my kids in the fall. What if my kids go to school on separate days? What's that going to look like? And, you know, so there's all these different scenarios, and even trying as a therapist, trying to walk through those scenarios with them and come up with plan A, B, C, and D is very challenging, because we don't even know. It's summertime and people are wanting to get out and travel and take vacations, or, you know, just do something fun and have something to look forward to. But all the stress even that creates, and the anxiety that's created around that of having a good time and being able to have something to look forward to, people are experiencing that piece as well. So we've changed, our lives have changed so much, and mental health the needs are just increasing tremendously day by day as people are experiencing barriers. The one thing that we keep going back to is if I, you know, come up to you and I say, hey, how are you doing today? A lot of times what we say is, I'm good, or I'm fine. And, you know, we know that that's just a normal response that we're supposed to give for people, right? That's our normal, but sometimes as we're asking somebody, hey, how are you doing today? we may have to piggyback that with a few questions of, like Carol said, of, if somebody has cancer or has been diagnosed with diabetes or something of that nature, we're asking more questions and we're asking to learn more about them and their situation and let them know that we're supporting them. So we need to remember to do the same thing. If we see somebody who maybe, is a little bit off or has been struggling a little bit, ask those questions. If they say they're fine, maybe they're not. And we just need to ask the right question to get them to open up. The other side of that we always talk about is that if I go up to you and I say, hey, how are you doing? Sometimes I'm expecting you to say I'm fine because I don't really want or have time for the, word vomit that may come out as we, as you do disclose what's happening in your life. So we have to be prepared and we have to be very genuine in our approach to be able to support people in all of the environments that we're in. And sometimes it's the stranger in the grocery store that it seems like they're struggling with something. How can we even be of support to them? Because we all know that everybody's experiencing stress in some aspect or many aspects of their life right now. And mental health is just becoming more crucial to address day in and day out. So the strategies, of course, for self-care, the self-management through all this, and being able to support your coworkers or other parents, teachers, neighbors, anybody that you come in contact with, even in our own home, it's so important for us to have that space that we can go to. Because I know even for myself, I'm at home right now working. I'm usually not, I'm usually in the office, but my husband's home. So, even when I'm done working for today, I don't have that time at my house to be able to just enjoy my day, do what I want to do this afternoon, and, have my time. So it's important for us to have a space that we can go to because we need that alone time. We need that time to regroup and just refocus and read a book or just take 20 minutes to just be in a space that is ours. Kids are home, kids have been home. We're oftentimes entertaining them, and whatever age. I was telling people before, I have a 21-year-old that was home from college, and we spent every evening entertaining her and cooking dinner together and all that. So that was a change in my schedule. And we just have to recognize those things. And it's not bad. We just have to acknowledge that it's different and that it's a change, and that also can create some stress and anxiety in our lives. So even the little things that we feel like we shouldn't be, we shouldn't be bothered by, it's okay. It's okay that those things are a change in our schedule. Those things are a change in our routines. And we need to acknowledge those things as well. Mental health is just, I don't think we've even began to see the impacts that COVID has had on people's mental health. Even within the hospital environment, we have many programs set up for team members, and they are reaching out. But at the same time, I think we have gotten through the first phase and people are just kind of like sliding by. And I do anticipate things will be different if we do get another wave. People will be dealing with things, not just in the hospital environment, but in general. We'll be dealing with things differently, if and when we do get another wave of COVID, and things have to look different again. So, we all have to play a part in getting rid of the mental health stigma. It's so necessary and needed. And, Carol touched a lot on the things that we can look for, just making sure that, if you see somebody who's struggling with their eating or their sleep, or maybe they're isolating a little bit more, or they are, maybe a little bit more irritable, they just don't seem like themselves. It would be really important that you speak with them, try to address it, refer them to somebody to talk to. I always tell people, like, even if it's just 1 or 2 sessions, it's so much better for somebody to reach out to me or a therapist, and be able to talk to somebody who's a neutral party, talk through it, work through something that's going on right now, start building a relationship, so that if something else does come about, that you have somebody to turn to. Because there's nothing too big or too small that a therapist can work through with somebody. Sometimes we just need that neutral place. I have some kids now, whether it's, 15 years old or 22 years old that I'm working with right now. And sometimes it's just they need somebody that isn't a parent, right? Because we as parents definitely give our parent advice, and sometimes they just need somebody who is going to say, work that might be the same exact thing that their parent is saying, but it's not their parent. So, even if it's a kid, encourage them. We're doing virtual right now a lot. I don't know if some people are back in the office, but it's so important that we are, referring to counselors and therapists right now, just even if they're just seem a little bit off. There's lots of tools, lots of resources in the community for people. We have there's virtual things online that people can do. So make sure that you're referring and that you're getting people connected in whatever way works for them. Sometimes their church at home is also a great space for people to turn to initially because they already have those relationships.
Thank you, Christy. That's a lot of great information that you shared. I'm going to advance to our next slide so I can share with our participants how they can ask questions. As a reminder, if you do have a question for Carol or Christy, you can put that in the chat function and I will pass it along to them for them to answer, or you can email your question to lcph.meetings@linncounty.org and we can cover that question as well. If you are able, indicate who the question is for to help with fielding that question. And if for some reason we get a lot of questions and we can't get to it during this town hall, we can follow up with you on that one. So in preparation for the question and answer period, we do have a couple of questions that may or may not have been covered by Carol or Christy, but I think it might be a good way to reiterate some of the responses. So the first question, excuse me, is what are common concerns and worries that you hear being expressed? Christy, I think you did a great job of kind of covering that in your remarks about all sorts of things, ranging from jobs to kids at home to social concerns. But for the purposes of the webinar, do you want to just briefly restate what those are?
Yeah, I mean, we have the common ones, right, that most people have been experiencing, whether it's changes at work, in their work environment, their kids, and kids not being at school, what the fall is going to look like. Again, like even we have an 18-year-old who's supposed to be going off to college, and, so what is that going to look like? Parents maybe having to change their work schedules, quit their jobs. There's just a lot of fears and concerns. And then the other aspect of what will happen if there's a second wave and we have to make changes again, and what will those changes look like? So yeah, just a lot of like uncertainties. We're also seeing a lot of people who are experiencing a lot of loneliness right now. So the lonely aspect, even if they're in a home with their whole family, they're still not able to, they maybe are a little bit more now, but there's still the concerns of going to have a drink at happy hour with friends, like maybe they used to after work, or, going to a movie and some of those types of things. So yeah, just changes in even their routine and their schedule, and creating some loneliness. People who have autoimmune or, immunocompromised people in their household. And I've heard people say that maybe they're splitting the house and one's on one side of the house and one's on the other, or they're not seeing their elderly parents or their grandchildren, because they don't want to expose them. So yeah, lots of different concerns and worries right now.
And I believe you touched a little bit about this as well, but the next anticipated question is what gets in the way of people seeking help? Stigma is a big one that is the whole focus of the Make It Okay campaign is to reduce stigma. But what other things do you see that get in the way of people seeking help?
Well, I think the stigma, but then I think there's also that uncertainty, like what do I expect when I go to sit in an office with a therapist? I work in one of the clinics with some providers one day a week, and that kind of seems to be a great model because people are very comfortable. So I used to have a lot of people who were even in their 60s and 70s that would come see me. And so it reduced some of the stigma because their provider would say, hey, we have a therapist right here. Well, they trusted their provider. So there is that stigma, the trust, the uncertainty, just, the time. A lot of people don't want to take the time. So I think we found even now with the virtual aspect is people are more apt to jump on or call because it's an hour, they can call, they can see you. And yeah, so it's been really good that we've been able to do some virtual stuff through this as well.
I'd like to jump in real quick, Caitlin, and add something to that. One of the things that I hear, see is, we kind of know when to go to the doctor. We know, I've got a fever, I've got my ear hurts, whatever that is. But because we don't always talk about mental illness and we're not comfortable like asking someone, do you think I need to go see someone? I think sometimes we're not even sure if we need to go. We don't really have we've never been taught at what point is it a time to go see someone. And I love what Christy said earlier, that, never a wrong time. And sometimes it's good to, just like it's good to go meet your family practitioner for the first time, even if you're not sick, and meet them and have them in place so that when you need them later, you know where to go and how to access them. So I think that's part of, it's all related to that stigma and silence around it.
That's a great point, Carol. Thank you. And then just another, way to break the stigma around mental health or to talk about supportive words. And Carol, you had a great slide on that. But in closing, so we hear it another time and remember it. Do you want to just remind us of what are some words that we can use to be supportive?
Absolutely. I think part of what's really easy to remember is to think about some of the things we might say if someone had any other illness. Use words of empathy, and to even just use open-ended questions of, tell me more about that, or how can I help? Can I bring you something? I've heard people say that mental illness is the no casserole disease. So nobody ever brings you a casserole because you're experiencing a bout of depression or your child is in the hospital with a mental illness. So be thinking about things like that when you know someone's struggling. Maybe you can bring them. Bringing people food is one of the things we do, especially in the Midwest, I think, to make people feel better. So it's okay to do things like that. But, think if some of the words you're using aren't the same words that you would use if somebody was experiencing cancer, like you wouldn't say, just think some, maybe if you think a little bit more positively, it will go away. You probably shouldn't use it for a mental illness either.
Thank you. That's a great way to help everyone transition into using supportive language. So I haven't seen any questions come in. So if you do have a question for Carol or Christy, please send it along and we'll get that answered. But in the meantime, I just wanted to share some resources that we have locally within Linn County for mental health. There's a couple of slides, so I'm just going to run through them real quick. We're lucky to have quite a few resources available to us, including the Foundation 2 Crisis Line, Tanager Place, Abbey Community Mental Health, the St. Luke's Counseling Center, Mercy Medical Center has several resources. And then across the state, Your Life Iowa, of course, the Make It Okay in Iowa page to visit there to learn more information. I think the Iowa Healthiest State Initiative may have discontinued their Mental Health Monday Facebook events, but they held those a couple of months ago and put them on Facebook Live, so the video is there. And then since this also links to COVID, there are mental health resources on the Gazette Coronavirus Resident Resource page, but also other COVID-related resources. So I will hang out just 1 second for questions, but I do want to remind everyone that there has been a whole series of virtual town halls, and in fact, this is Christy's second appearance on a virtual town hall for COVID-19. and to watch the previous town halls and to view the PowerPoint slides and the resources that have been shared, you can visit the linncounty.org public health page and then go to the COVID-19 section and click on virtual town halls. The link is also included on this slide that gets you there directly. The recordings are also available on the linncounty.org YouTube page if you'd like to view the recordings. So that's where this one will be posted as well. So I am not seeing any questions for Carol and Christy, so you must have done a fabulous job sharing the information that we have. So I will go ahead and end our, oh, there's one that just came in. Erin says, thank you for the information. I'm going to go ahead and end the recording and then end our town hall for today. Thank you so much to Carol and Christy and to all of our participants for joining us today.